So the idea here is that clinical decision making is more and more difficult with the complexity of the data we have and the immensity of the changes in the management of various medical problems such as atrial fibrillation. So this trial was looking at a clinical decision support system that could help a physician manage a patient and improve outcomes by integrating guideline information and using a intelligent computer-based system that will improve decision-making processes to reduce specific outcome measures in patients with atrial fibrillation. This is a fairly large study, however, it may not have been properly powered to determine a difference between clinical decision-making as it is presently done and clinical decision-making using a support tool. It did appear that there was a trend in the direction of the clinical decision support tool. However, that did not make significance, and there are various issues that may impact on how we interpret these data. First, the outcome measure may not be the correct one. The second issue is the system may not be properly designed to allow the physician to utilize it so that it will impact on how there can be changes in the management. But I do think that the idea is very good, and I think that this could potentially enhance the ability of physicians and other healthcare providers to improve their quality of care ultimately, and to improve the outcomes of our patients that have atrial fibrillation or other problems. So I don't think we should give up on the idea, but it does show that a physician in practice who is knowledgeable and can presumably properly manage a patient without necessarily having all the tools that are required to understand all of the present data on the specific issues with regard to, for example, atrial fibrillation, can still manage patients pretty good.